do, you're kindly welcome. My name is Dr. Elias Dominuka, and today I'm going to take you through mental disorders and how we can actually treat it. So pay close attention. So what are mental disorders? Mental disorders are all disorders which can affect one's mood, thinking, and behavior, which can in turn affect one's psychological, social, and mental well-being. So mental disorders can vary, ranging from depression, anxiety, PTSD, and these are just some of the common examples of mental disorders that our society faces. So how do we actually treat this, and how do we actually help the client? See, first most important step is actually identifying the trigger. So these mental disorders mostly come with specific triggers. For example, you can have a patient who's having depression, and secondary to a chronic illness, which can be lung cancer stage 4. So the specific trigger to this patient is a chronic illness. So you have to take careful history with the patient, creating a very good rapport that will able to make it easier for you to extract information and to identify that specific trigger. And this trigger will bring us to the second most important step, which is helping the client to actually accept the trigger. So for our patient has stage 4 of lung cancer, which is great in the depressive episode. So by creating of a good rapport, you're also able to help the patient accept that, okay, I do have this chronic lung cancer and it's causing my depressive episode. So what am I going to do about it? So you see, that's very important, and that actually makes the mark to the third step, which is empathy. So you're supposed to be empathetic towards your client, meaning that you have to be in the shoes of your client. I don't mean that you have to be sorry for him. No, you just have to share some of your life experiences, or maybe you can cite some various examples of patients that you have treated with various episodes and how actually they manage to go through it well. So this will not only make the patient feel better, but will also make the patient feel confident that you're actually the right person to actually take him through this rough patch. And this brings us to our fourth most important point, which is exploring all the positive things that give the client positive energy. So you can ask yourself questions. Does your patient love sports? Does your patient love eating? Does your patient love being around his family? Does his patient have any other leisure activities? You see, so by identifying these and actually keeping the patient with this positive energy around him, it will actually make it easier for the patient to actually say, yes, I have these people who are here with me, and why shouldn't I do all I can to actually go through this? You see, so this brings us to the fourth or fifth. Yeah, brings us to the fifth important point, which is focus cognitive groups. So focus cognitive groups are one of the non-pharmacological treatment of mental disorders, whereby a client meets with other clients who have almost the same episodes or the same mental disorders, and meets also with people who have actually positively passed that stage, and they're sharing their life experiences on how they did it and what they're going through. So what does this do? And this actually makes a patient feel like, okay, I'm not the only person in the world who's going through this, and yeah, there are people who have actually gone through it and they managed to go through it, so why can't I? So this brings more confidence to the patient, and they'll be like, okay, I'm going to do everything that I can to actually go through the treatment plan. And this brings us to the medication part. The medication part can only be possible if you have followed the above what we've just talked about, because these mental disorders are associated with high values of medication compliance. You see, and why is that? And the main reason is the clinicians do actually give a reason to why clients should actually take the medication. They have not done a lot of report doing and following those steps, so the patient is like why should I take these medications, and why shouldn't I stop? You see, so all these are questions that the patient asks himself when it comes to this thing about medication. So these medications, they target the hormone receptors, cortisol, dopamine, and all other necessary hormonal receptors which are responsible for one's overall mood. See, and finally we have this very important step, which is actually making a good follow-up plan. Actually following what the treatment process and the outcomes that the patient has had, and the day-to-day how does the patient actually improve by using your method, you see. So this can go simultaneously by actually you can give a number to your client, so this will make the patient even be more willing to actually talk to you, and he will give you constant feedback, so you can schedule appointments on a weekly or monthly basis where you're going to see the overall improvement of your patient. So if your patient is having depressive episodes, you'll ask the patient to actually record how many episodes he gets per week and then per month. Then later on, it comes to show it to you, and then you can actually see how this patient has improved, the medication that is taken, and take note of the symptoms. Have the symptoms subsided, or have they continued? But it should also be noted that prolonged use of medication can actually lead to other side effects, such as excessive sleep, loss of appetite, some people even vomiting. So you have to bear these things in mind while you're providing that help. So thank you for being with me, and I'm really happy to actually share this knowledge that we have. Mental health is a very big issue that needs addressing to the society, especially the youth. We go through a lot, and I'll advise you to talk. Whenever you get the chance, just speak. Find someone that you trust, talk to them about it. It will make you feel better than just staying with everything alone. So I'm here to actually remind you that you can actually ask me any question relating to mental health. I'll be more than happy to actually give you the highest level of participation. So I'm looking forward to the next video with you, and for the meantime, thank you for checking in.